Medicare season, open enrollment season is just about on us. And if you are Medicare eligible or you have a loved one, a family member, a parent that's getting ready to enroll in Medicare, it can be really, really confusing. And for many of us that don't have that experience, we think of Medicare as just one thing, but it's not. It's a lot of different parts. And today we have an expert in the Medicare business, Jason Stevens with Stevens Insurance. And we've been doing business with Stevens Insurance, probably almost 20 years now. And welcome, Jason. Glad to have you.
Yeah, thanks for having me on.
Absolutely.
Glad to join.
Yeah, so what I thought we could do is just kind of break down Medicare a little bit. You know, it is alphabet soup, literally, right? A, B, C, D, and all the other letters that go along with it. So maybe if you wouldn't mind, just kind of walk us through big picture of Medicare, and especially with the eye to somebody who's getting ready to enroll for the first time. What are the key things that they need to know?
Yeah, absolutely. So Medicare it breaks into a number of different parts that are all lettered out, and there are even plans that are separate from that are all lettered out, and it always throws everyone off. But a lot with Medicare, it generally starts with these various different parts, and a lot of people don't know what is Part A or what is Part B or Part C or D, etc. The two main parts of Medicare is as A and B, which are they break into hospitalization for Part A. Medicare refers to Part B as medical. I always tell people it's the services rendered from Medicare, but those two parts are what's actually hosted by the federal government. Everything else that you hear about is hosted by private insurance companies, and they're either as a replacement of or benefits in addition to Part A and Part B. So Part A and Part B together generally covers about 65 to 80% of the bills hosted by federal government. All the other parts are different types of plans you could go into for in addition to or in replacement of Medicare.
Got it. So when I know, for example, we get calls from clients where people are looking at the Medicare website, and it's a little confusing. And there's a lot of insurance companies that are running ads on TV, and then you're getting phone calls, at the house. How does one kind of navigate all of that? It can certainly be overwhelming.
Yeah, definitely, and especially during this open enrollment annual election period. It's difficult because the market tends to drive or make it easy to drive towards Medicare Advantage, and so there's just so much marketing out there and so much of all these robocalls and what people will say is scam calls. And it's just there's so much drive to move to that market, but not necessarily always in the benefit of the consumer.
Well, exactly, and sorry for jumping in there, but my mother-in-law was in a situation where she got switched, I think 3 or 4 times in a 6 or 8 month period from different Medicare Advantage plans. I mean, it went from insurance company A to B to C, and then back to A, and then C again. It was relentless, and it was really hard for us to stop it.
Yeah. There have been bill after bill and regulation after regulation added. I know CMS is trying to counteract this a little bit, and consequently, they've made things more difficult for agents, I think, that aren't doing that.
Right.
But it hasn't stopped, and so I think the best advice to give in this is just to keep a close eye on that, pay attention, and know during this time that's going to happen, and maybe just try to connect with someone you can trust that can get you that accurate information instead of just a random call that comes in.
Yeah. One of the things that we did actually is we had the mail for my mother-in-law, we had it redirected to our house. And so while that, was a certain burden, let's say, at least we were able to catch it. We would receive a new notice from whether it's Anthem or United Healthcare saying, oh, congratulations, here's your new insurance card. And we would call at least within the grace period where we could get it, canceled and reverted back. But that's just an idea. But we really had no way of proactively actively stopping it. And so I guess, word to the wise is just be on the lookout for that. But while we're on the topic, so what's the fundamental difference? I mean, usually I always like to say follow the money, right? And that's what's driving all of this marketing to Medicare Advantage. What's the fundamental difference between a Medicare Advantage and the traditional components of Medicare?
Okay, good. Yeah. So original Medicare or traditional Medicare, that's actually holding Part A and Part B as a primary insurer, and then forcing the insurance company to set under Medicare and after Medicare, which means they don't really have any power. They can't say yes or no to a doctor or require prior authorizations or deny any type of procedure. But in a Medicare Advantage, it's very different. It's not setting a secondary. You're actually signing over, you're leveraging Medicare. So you're really signing over your rights to Medicare to the insurance company, so they take over as primary and host the benefits. And that's kind of like what you're saying. It's what happens in behind the curtains there is that Medicare pays a stipend, and it's a pretty healthy stipend to these insurance companies. So they're not paying claims anymore. They're paying to the insurance companies, and now the insurance companies will either define networks or set benefit structures or whatever they need to do to see a profit there.
So then the more efficiently or even the more tightly the insurance company manages that care, the distribution of that care, that can increase their margins because they're getting paid a certain stipend from Medicare for those for that enrollment, that membership.
Yeah, really the main difference between these two is that Medicare Advantage is very focused on the price of the plan and will make accommodations in the benefits in provider networks or whatever else they need to try to maintain that price of that plan. Traditional Medicare with like a Medicare supplement or Medigap, that's more about control, right, and stronger benefits that can't change. So that's usually just very different goals where you're focusing on your benefits and your access to care and your control, or on the price of that plan.
Got it. And one of the questions that we always get, so our corporate clients, we have a commercial plan, right? You have a business, it's architecture, engineering, construction. Maybe they've got 100, 150 employees. They've got a certain number of participants that are 65 or older. And they always get these messages that, gee, don't delay because you're going to have penalties of going on if you don't go on Medicare right away. Yet they're on a commercial plan, and let's say that their Part D is creditable, which I want to get to in a second. But for somebody who's working at a company that has, good benefits and wants to stay on that, do they have to enroll in Medicare, or can they wait on that?
Great question. And yes, this always is a huge confusing point for most everyone on group benefits. No, it's completely optional to go on to Medicare. You might see a lot about penalties that you might get if you don't go into Medicare. But as long as you are actively employed and you maintain benefits through that employer, you're an eligible opt-out.
Yep.
So you are okay to stay on those group benefits.
Got it. The one thing that does come to mind is to make sure if you are Medicare eligible and you go to retire, do not go on COBRA from your employer because that's not considered to be creditable coverage, as I understand it.
Correct. Yeah, that one gets tricky too. There's a bill that's actually pushing to try to correct that. It hasn't got enough traction yet to get passed, but COBRA is not considered technically creditable coverage with Medicare because you're no longer actively employed.
Right.
So
although the coverage is
maybe
the same,
you
wouldn't think that there would be that big of a difference there.
Yeah, and I mean most of the rest of the market sees it as creditable. It's just Medicare's eyes. But sometimes people would get maybe a severance if they didn't retire but they were let go, and they get 6 months or 12 months or whatever paid by COBRA. Yeah. And sometimes people might use some of that, but you definitely want to make sure you're getting into Medicare as well.
Right. That's a key differentiator and something that we always try to communicate. But again, occasionally you just run across it because somebody doesn't know. They're 66 and they separate coverage from their employer and get a COBRA notice, and it's what they know. Their doctors are all set up, and so occasionally we run into that. So we've been using this term creditable, and it makes me think of Part D. Can you share a little bit about what is Part D, first of all, and what does creditable coverage mean, and what are some of the changes that are happening in 2025?
Okay.
That was a three-parter.
Yeah,
I can repeat them back.
yeah,
We need to,
that's a big
yeah,
one. Yeah.
yeah,
No, so Part D first. What is it? Even though it is a part labeled as a part of Medicare, it's the prescription drug coverage, which is hosted by private insurance companies. You choose a plan, it's just regulated by Medicare.
yeah.
So this is the actual prescription drug plan benefit, but how it works is now starting to move towards a little bit more similar to what employer group plans look like, where you would have fixed copays and things like that. What people have run into for years now, and going through the end of 2024, is that there's a little bit higher out of pocket costs generally,
Right.
and there's a donut hole to face, which a lot of people hear of and just say, I don't want it. I've heard it's not good, but I have no idea what it is, and it's good not to know if you don't. But at that point, you're generally paying 25% of your medication cost. The big changes that's hitting the market for next year is that all of this is getting corrected, but it's in these massive steps that's sort of positioning and moving the market rapidly. But we're going down to a 2,000 maximum out of pocket for prescriptions. The donut hole being completely wiped from the market and eliminated.
Yep. And so what was the out of pocket max could have been what, 7,000 or 8,000, and now it's going down to 2, or you probably depended on the plan that you purchased.
Actually, yeah. Prior to 2024, there was no maximum out of pocket. People would pay to no end on prescriptions. Yeah. Starting January of 2024, it's set to 8,000 out of pocket maximum, and now January 2025 will be pushing to 2,000 out of pocket maximum.
So those are pretty significant leaps. Are you seeing the premiums for Part D also jump up?
Unfortunately, yes, for a lot of the plans, not for everyone, but the insurance companies have been forced into a corner a bit to save face for them a little bit here. They don't really, they can't just lose money on it. So there's some aspect there, but they either have to raise the prices or they have to, as they'll say, apply cost saving measures, right? But that could be cutting medications off the list, applying further prior authorization requirements, denying prior authorizations. It could be a lot of things. Taking those lower price plans can be a little bit risky in the market in the years to come.
They're ratcheting up the management of care, making it more challenging to get through to that prescription, perhaps.
Exactly. Yeah.
And the other thing that always fascinates me about the Part D market, it seems, and you can jump in and correct me where I'm wrong, but if I have a particular, let's say I'm on 3 different prescriptions and maybe my spouse is on 4 different prescriptions, entirely different, the plan that I might pick would perhaps be different than the one that she's going to pick, because it kind of depends on the formulary that they've selected, and therefore the drugs that we have that makes this particular Part D plan more attractive to me, and a different one more attractive to her. Is that an accurate assessment?
Yeah, absolutely. It's actually pretty uncommon to see both spouses in the same plan, unless maybe neither of them they actually happen to be taking the same medications or something.
Right.
But yeah, a lot of it has to do with the medications, pharmacy preference, even what other medications are likely possibilities as alternatives that could live in the future into that year, right? Because you're choosing that prescription drug plan for the entire calendar year. There is no changing that plan, even if your medications change.
Yeah.
So it's important to get into what's most appropriately set for that individual.
Yeah, and that's what I was thinking. Certainly somebody that is, on battling cancer, let's say, and they're on a particular type of chemotherapy, and that changes in May. What do they do at that point if the new drug is perhaps not covered? Maybe there's some approval process in that particular case.
Yeah. So all the plans out there, on average, state by state for 2025, it's going to be 16 different plans to choose from for prescription drugs, and not a single one of them covers every medication under the sun. So you've got that chance. But if you run into that, then there is an appeal process that can go forward, because you can't change the plan. When you do appeal, depending on the medication and the need for it, you may actually be able to get a 1-month supply at usually a tier 3 or tier 4 copay level, just so they have some time to go through that appeal. And then the insurance company can still deny that appeal,
Sure.
but at that point, even if you run into that, there's further appeals you can file to try to combat that
Yeah.
and get that
If
medication
it's
covered.
really medically necessary, for sure. So
Yeah.
let's talk about a couple of best practices, right? So if there's one that we talked about is if somebody is actively at work and on a commercial plan with their employer, they can stay on that plan. It's just when they go to retire, probably 2 to 3 months in advance of that, they should start working with someone like you or engage a Medicare expert. What's the timing on that if you're getting ready to retire from a company?
Yeah, so at first I'd say it doesn't hurt to get involved and just get to understand it at least, or meet with someone and plan it out, no matter how early, even if it's 6 months out, right? However long that might be. But usually you want to take action at about that 2 month mark if you can. That's sort of like the golden rule.
Okay, perfect. Okay, so that's a good one. And then how does somebody go through sort of the decision-making process around whether they want to go traditional Medicare with maybe a Medigap policy as one option versus the Medicare Advantage as an entirely different option? What are some of the decision-making points that you see that are really important there?
So a lot is cost, but as the same route I mentioned to everyone is, you have to try to factor in costs in all levels, right? Not just what you're paying for the plan, but what you might be paying in co-pays or co-insurance, and what that might be down the road, right? If you are going into a Medicare Advantage plan, if something becomes costly, you have to qualify medically to shift that market. So usually the decision there is looking between if you're comfortable giving up a little bit of that control, allowing the insurance company to manage your health care a bit to drive that cost down, and comfortable to stay in that position if something big happens, then that's when people may start looking into the Medicare Advantage plans. Otherwise, if you're looking just to have stronger benefits or to have more control, or you don't want the insurance company in the middle of making those decisions, then that's usually when you're looking on the supplement side.
I also think about it too. Perhaps if somebody wants to do a lot of travel, or they don't want to be hemmed in by a particular network, they just want a little more freedom and flexibility. This is probably an oversimplification, but I think about it a little bit like in the commercial market, the PPO versus the HMO, and traditional Medicare is a little more free, and then the HMOs, which would be akin to Medicare Advantage, would be a little tighter on the management of the care. Is that a fair thought process?
Yeah, actually, excellent point. And traveling is one of the big things that we always check into, because it is a huge factor that steers towards Medicare supplement. But you'll even see in some regions where there is a such thing as a PPO for Medicare Advantage, and in the vast majority of those cases, they're referred to as a regional PPO, because it's not like you see from your group plan that you had or whatever else.
Go anywhere.
It's not the same.
Yeah, interesting. Yeah. And then then the next one would be for Part D, the prescription drug coverage. Somebody thinking about going on to that. What's kind of the best way to figure out, hey, these are the medications I'm on, which is the best plan for me? Are there tools out there, or how do people go through that process?
Great. Yeah, there are a couple ways to be able to do it. This is something I would say is really not a bad place to be talking to an agent or an advisor. There are tools that are available, but the types of what we have access to and what our team has built is so much more involved and robust, and it allows us to look at more than just what that total cost ends up landing at in the end, which is important. But there is a tool that Medicare does actually make available to the public. And if you just go on to Medicare.gov, you can punch in your medications. You can see what every single plan is for your region and what your cost would be, including those copays for the medication. So it gives you at least a general idea of what what that would be.
Yeah, fantastic, awesome. Well, Jason, thank you very much. This has been really illuminating, and I sure hope that people were able to get some good takeaways. And if anybody needs any direct advice, feel free to send me a note. Find us at relational.com, or you can reach out to Jason and his crew at Stevens and Associates up in sunny Santa Barbara. Well, not always sunny. Sometimes it's a little cloudy there by the coast, but
here and there.
Yeah, being a gaucho, I'm quite familiar with it. Well, Jason, thank you very much. I really, really appreciate your time.
Of course. Yeah. Thanks for having me.
Yep,
Appreciate it.
absolutely. Thanks.